Okay, so in today's chapter, we will be covering the chapter 8, that is external diseases of external ear. Okay, let's start. तो डिजीज ऑफ एक्सटर्नल ईयर में अगर हम नॉर्मल पिना देखें, नॉर्मल पिना का जो हाइट होती है वो 6 सेंटीमीटर की होती है और इसका जो पिना और मेस्टॉइड का एंगल होता है वो 15 to 30 डिग्री सेल्सियस का हो। अब लेकिन अगर मान लो उससे ज़्यादा हो जाए, मोर देन 30 डिग्री, तो हम उसको बोलते हैं प्रोमिनेंट ईयर और वी से इट एज योर प्रोट्रूडिंग ईयर. दिस इज द थिंग. Now our surface anatomy. In the surface anatomy, if you see this diagram, this is the scaphoid fossa that is parallel to the helix, right? This is the concha. This is the part concha. The concha is divided into cymba and cavum. Cymba is the upper part, cavum is the below part. That you need to know. Clear? Now let's go to the pinna. Pinna, basically now diseases of pinna. Pinna is basically divided into, there is congenital problem. It can be either traumatic problem, it can be either inflammatory problem, or it can be either neoplastic disorders. So we have divided into like this. So first of all, let's talk about the congenital deformities. Let's see this image. Anosia. This is anosia. In this you don't find any pinna. There is no pinna, right? That is the anosia. Basically complete absence of pinna in the lobule. Okay, right? And let's see microtia. Where is microtia? Microtia is this. This is microtia of right ear. It looks like peanut. Microtia is peanut ear. It looks like a peanut. That's why this microtia. Clear? Peanut ear. Macrotia. Macrotia means वो पीके वाले कान होते हैं. पीके वाली मुंह में आमिर खान के जैसे कान थे, वैसे पीके वाली मुंह वाला कान में. That is large ear. Large. You will find pinna. Now let's talk about the bat ear. That is important. That is prominent ear. See, this is the bat ear. These two diagrams. In this bat here, what is there? There is inadequate development of anti-helical fold. You know, there is the anti-helix. So there is no development of any anti-helix. There is hypertrophied concha. The concha will look like this. Hypertrophy. Guys, these are the things. And this is the thing. And the protrusion will be there. Right? Protrusion will be there. More than 30 normal. This is the after normal size. This is the protrusion. More than 30 degree angle is there between the pinna and mastoid. That is the thing of bat ear. You should know. Okay. Bat ear, abnormally protruding ear, concha is large, poorly developed antihelix and scapha. And the cosmetic surgery can be done after 6 years. Clear? Great. Now let's talk about the cup and the lop ear. See, this is the cup and the lop ear. This one. This is the cup and the lop ear. This cup and the lop ear, basically it looks like a cup. Okay. But this is a severe form of cup. Basically, it forms a snail type of deformity. This looks like snail or cockle shell. This is a severe form of cup deformity. So, cup lop ear is also known as hidden or buried ear. There is hypoplasia of the upper third of the auricle. Yes. And pinna look like cup. And the greater deformity is known as cockle shell or snail shell. Clear. Now, let's talk about cryptotia. That is known as pocket ear. See this diagram, image. This image, you can see this ear is embedded in the skin of the scalp. That is the thing. This is known as top portion of body in the scalp. This is your cryptotia or known as pocket ear. Okay. Now coloboma. Coloboma is basically a transverse cleft. This is a transverse cleft that is given here on this one. Basically, yeah, this one you can see. This part. That is a coloboma. Okay. And you can see this part. Transverse cleft. Now, there is minor deformities like absence of tragus, Darwin's tubercle. Darwin's tubercle is where? Darwin's tubercle is here. See, this is the Darwin's tubercle, a pointed tubercle at the helix part. Now, there is additional folds like known as stalgia and satires here. See, stalgia and satires here is important. Stal here, if you see this diagram, this is stals here. And this is satires here, pointed one. So, in satires, what is happening? The horizontal and the vertical helix forms the apex. This is the satires ears. And stals ears is what? Stals ears is basically the helix should be normally be folded is flat. You see, the helix that is normally folded is now here flat. That's why it looks like this. Here is pointed, here is flat. That's the thing. And satires is also look like a horse, right? So we have done. Now one more thing is known as pre-auricular tags or appendages. See, if you see this diagram image, if you see this image, this is pre-auricular appendages. These are the things you must have seen. That is known as pre-auricular appendages. So they're skin-covered tags that appear in a line drawn from the tragus to the angle of the mouth. Okay, that is the thing. Now there is known as pre-auricular pits and pre-auricular sinus. See, pre-auricular pits is basically what these are the pits. A normal small depression. Sinus when it forms an epithelial tract beneath it. That is a sinus. So pre-auricular pit is depression in front of the crus and the helix or above the tragus. Pre-auricular sinus epithelial tract. Incomplete fusion. It can lead to abscess later. Okay, that is the thing. So you have to drain it. So basically, this is all about the congenital abnormalities. We saw the images also, and it is much clearer now. Okay. Now let's go to the next part. That is the trauma to the auricle. We have done the congenital. Now we are going to the trauma part. Trauma part, what you are going to see, there is one thing, hematoma of the auricle. Hematoma auricle look like this. This is the hematoma. The blood is beneath this, beneath this cartilage. That is hematoma of the auricle, right? So the collection of blood between the auricular cartilage and its perichondrium. See if this is the image. You can see this is the skin. Then we have this perichondrium. Okay. Then there has this perichondrium. Then between this we have the cartilage. Then this is loose connective tissue. So in between this perichondrium and the cartilage, there is collection of blood that is known as hematoma. Clear? Okay, great. And it can be happen because of the any blunt trauma. Blood trauma by, like, for example, boxers, wrestlers, all it can because they can hit the ears multiple times, so it can lead to this bleeding. ठीक है, तो इससे हो सकता है ब्लड ट्रॉमा. कैसे होता है? ब्लड वेसल रप्चर होती है और उसके बाद तुम्हारा कार्टिलेज एंड पेरिकॉन्ड्रियम बन जाता है और ये ब्लड सेल जो है ऑर्गेनाइज हो जाते हैं. तो बेसिकली इट लीड्स टू, अब क्या होता है, कार्टिलेज है, just the cartilage, so cartilage get disorganized. So cartilage get disorganized from cauliflower flower, or also known as pugilistic or boxer seals. Clear? अगर कॉम्प्लिकेशन क्या है, इसकी कॉम्प्लिकेशन अगर सीवियर हो जाए तो इट कैन लीड टू पेरिकॉन्ट्राइटिस. तो इसके लिए हम क्या करते हैं, हम इसके लिए एस्पिरेशन करते हैं. हम इसके लिए एस्पिरेशन करते हैं इस ब्लड को, वी रिमूव इट बाय निडल. ओके, एंड इफ इट इज सीवियर देन वी हैव टू कट एन इncision and we have to drain. That is the thing. And if it gets severe, if aspiration fail, then we do incision and drainage. Okay, then we also do the pressure drainage. This is the pressure dressing. Pressure dressing means we basically put a gauge behind this, so that the scalp and the ear don't get in contact, और इससे हम ऐसे पूरा प्रेशर लगा देते हैं उससे. प्रेशर ड्रेसिंग, दैट इज द थिंग. और दूसरा एक और चीज होती है जिसको बोलते हैं बॉल्स्टर्स ड्रेसिंग. बॉल्स्टर्स ड्रेसिंग में व्हाट वी डू, वी बेसिकली डेंटल रोल्स होते हैं, डेंटल रोल्स को अप्लाई करते हैं और सूचर्स में थरो सूचर्स वी पुट इट so that the pressure is there, and basically this is known as bolsters dressing. Okay, this is a dressing, this is a type of thing. So we have done, and we also in all cases we give prophylactic antibiotics we have to give. Okay, great. Now there is known as another thing, laceration of the auricle. See, laceration is auricle. This is the laceration. This is the laceration that happened. Laceration of the auricle. So what it is basically, it is basically the perichondrium is stitched with absorbable sutures. These are the sutures that is there. You can see there's a sutures. These are suture absorbable sutures. Got it? So sometimes what happen, it basically, what does it do? It prevents stripping of the perichondrium to the cartilage to avoid any avascular necrosis. That is laceration of auricle that is there. Okay, so we have to repair it as soon as possible. We done it by what? We do it by absorbable sutures, or we do it by some non-absorbable sutures. That is the thing. Clear? And antibiotics we give. This is laceration. Avulsion. Avulsion means this full ear has been removed. Okay, that is the thing. Full auricular pinna. That is avulsion part. So if some part is still attached to the pedicle, we do the primary reattachment. If say whole completely it is removed or avulsed, what we do, we have to re-implant in selected cases by microvascular techniques, or implant cartilage in the post-auricular skin, or later reconstruction we do. That is the thing we have to do. Another thing is this diagram. If you see, this is frostbite. This is frostbite, blackish thing due to frostbite. So basically what happens, due to temperature it can lead to frostbite. So how do we do it? We treat it by rewarming with moist cotton that's at 38 to 42 degrees Celsius. And we use 0.5 silver nitrate for superficial infection. We use analgesics. Why? Because rapid rewarming causes considerable pain. All those things we do for basically frostbite and all. Okay, great. Now let's see this keloid of auricle. If you see this diagram, this is keloid. This one is keloid. You can see this is the extra part, scarring part. That is the keloid. Got it? Great. Now, how to like prevent it from recurrence? Basically, we give the total dose of 600 to 800 radiation we give, and local injection of steroid after excision. We do this for keloid. Okay, great. So this is we have done. Now let's go to the next part, that is inflammatory disorders. See, inflammatory disorders basically, if you see erypsilas, where is erypsilas? See, this is the erypsila. This diagram, this diagram, this is erypsilas. Images, all these images have erypsilas. So it is basically a dermal infection, superficial infection of beta hemolytic streptococci. Important point, beta hemolytic streptococci. It involves skin of face and pinna. If you see this diagram, see this part, this redness is on the face also and on here also. That is the erypsilas. Okay. And the important thing about it is we see a millions ear sign here. Millions ear sign. Millions ear sign is what? The lobules are enlarged. You can see. That is the millions ear sign we find here. And that is all about erypsilas. And the erypsilas, one more thing, that is erypsilas is involved area. If you see this involved area are red, whole, it is a whole red, and it is tender also. It get tender and it is basically indurated. That is and it is also well demarcated. That is the thing. Okay, so for treating it, we will do what? Oral synthetic penicillin we will do. Let's talk about the cellulitis. In cellulitis, what is there? Basically, cellulitis is basically what? Subcutaneous tissue infection is this. Cellulitis is basically subcutaneous tissue infection. So basically both look same, but the thing is this erypsilas is well demarcated, but this is not well demarcated. It's diffuse, not demarcated edge. That is the thing between difference between erypsila and cellulitis. Clear? That is the thing. Subcutaneous tissue with staphylococcus. This is staphylococcus. That is beta hemolytic streptococci. This is the difference. And complication can be otitis externa or mastoid operation can be lax in duration. Okay, great. Now let's talk about the next thing is perichondritis. It basically results from infection that is secondary to laceration, hematoma, or surgical incision. Okay, and the common organism is Pseudomonas here. Pseudomonas, clear? And the important thing is this part is red and hot and painful. Okay, and another thing is the lobule is spared here. Why the lobule is spared? Because the perichondritis happens where on the cartilage. Cartilage in yoga so is spared because it does not contain any cartilage or perichondrium. That's why the lobule is spared. Because as I told you in external ear part, the lobule is spared because it doesn't have any cartilage or perichondrium. Okay. Great. This is perichondritis. And relapsing polychondritis is basically autoimmune disorders. Okay, that is the thing. Entire auricle except lobule become inflamed and tender. I have already told why it is. Okay. Now the next thing is Chondrodermatitis nodularis and Chondrica helicis. See, if you see this diagram, image where it is the image. See this image. A nodule on the helix, that is the Chondrodermatitis nodularis, Chondrica helicis. The small painful nodules appear in the free border of the helix in men about age of 50. That is the thing. It is tender and people are unable to sleep. We have to do the excision of it. That is this thing. So we have done the external ear, congenital. You have done the trauma. You have done the inflammatory disorders. And the tumor part is also there. Tumor part is in the different chapter. We will do it separately because it is a little bit big. Okay, then thank you for the listening.